Hello, Angelos.
Hey, Daniel.
Obviously, come here today to sort of just get your feedback as a client that's been using our KaVo OP3D system now for a number of months. Angelos is a customer typical of a dentist that we meet that is interested in looking at the technology. Now he's owned it for a little while. Wanted to buy him some lunch and say good day, but also sort of ask him what he thinks about the system and a few questions. So Angelos, if I may just ask you a few questions.
Yeah, absolutely.
Angelos, look, I suppose many of our customers want to sort of know, why do you want a CBCT in your practice as a clinician?
Sure. Well, look, for me, I run a general practice. I do run-of-the-mill type of work, and I also do implants. And I thought it'd be really useful with my implant treatment planning to have a cone beam CT machine on site. I can treatment plan the case. I can discuss the treatment with the patient there on the spot. Work it up, and then be able to tell them straight away. Are they going to need grafting? Are they not going to need grafting? Can we do an immediate? With endo, I've found it really useful for endo in terms of finding extra canals, knowing straight off the bat whether the tooth is 3 canals or 4 canals, and where they are and how I can access them. Really good for diagnostic purposes. Someone comes in with some pain, they don't know exactly where it is. You take a cone beam, the PA looks like it's absolutely fine. You take a cone beam, there's a massive PA lesion on the tooth that's hidden that you don't really get to see. So all those things have been really useful for me in adding value to my patients and being able to kind of treatment plan on the spot.
So it's been well received, the technology, by the patients? What's it meant for them?
It's just been really useful being able to tell the patient, look, you need 3D imaging. I can't quite tell from a two-dimensional image the type of treatment that you need or what we can or what's possible. So we need to take 3D images to be able to figure out what's going on. And you bring them here, put them in the machine. Within a minute, they can see their photos, their images up on the screen. You see them look at all the different angles, and they're like, wow, it's amazing what you can actually pick up.
Yep.
So it just kind of makes them feel like our practice is cutting edge.
Sure.
So that's been really useful.
And has it made a difference to you, obviously, commercially as well? I mean, obviously the clinical side, is it? I mean, you don't have to say what you're making, but we just talk about, is it covering its costs? That's all I'll ask.
Well and truly.
Yep.
Well and truly. I mean, I reckon by the end of 1 year of having the machine, we'll be almost close to paying it off to that degree. So it's well and truly commercially viable. If you run, I mean, I only run a 3-chair practice, so I can imagine if you've got several clinicians working and several of them using it, you'll definitely well and truly pay it off. You
think it will cover itself for a solo clinician?
Yeah, well, I mean, the way I operate my practice is I've got an associate who's quite very conservative in terms of his treatment. He doesn't really do a lot of implants or mold renders or anything like that, so he doesn't really use it much. So I'm pretty much using it solely myself, and the hygienist uses the OPG function quite a fair bit. So based on us two working together, that's where we're kind of covering our costs well and truly. Yeah,
that's fantastic, Angelos. Look, any tips for any of your associates or colleagues, for anyone that's considering a CBCT, obviously going through the process and the systems you looked at?
Yeah, look, for me, look for a system that's going to give you good image quality, and one that's going to be easy to use, easy to get used to, one that's got good software features that you can kind of get used to using well and get the best out of it. But also the ongoing support. There are a lot of good machines out there, but you don't necessarily get the great support afterwards, or the maintenance or the tech support when you need it. I've had no problems with any of the teething issues that we've had with the machine in the initial period. They've always been really quick to get back to me and fix things up. So that's been really useful. But,
so Australian, and you'd say the reasons for choosing Australian Imaging and dealing with us has mainly been the service support side.
Oh, yeah, absolutely. I mean, the fact that it's a small company means that you've got someone there, you can pick up the phone and talk to someone straight away and get the support you need, as opposed to kind of being put through to like a help desk, in a big company. I've found in those situations that the support isn't quite as readily available as what I'd like.
And Angelos, we've obviously started our study club as well. That's there to help the clinicians. So, these are the sorts of things. And obviously having Steve Cross helping the dentist too, and I know that you enjoy that, and you're starting to become a good part of that too. What are your thoughts on a company like ours doing something like this?
Yeah, I think it's fantastic. It's a great value add for clients. to be able to have that opportunity for ongoing learning. And you know, the software has so many features that that if you don't know about it, you're kind of not really utilising it to maximum capacity. So it's been really good having Steve available. You know, I've given Steve a call every now and then just to ask him some questions, and you know, being able to kind of pick his brain and have him present certain cases with the different features with the software has been very useful.
Yeah, clinician to clinician definitely makes a difference over a salesperson. A salesperson wants to help but doesn't have the clinical knowledge.
Yeah, absolutely. And Steve's been in the game for a long time, and he's seen a fair few cases in his time, which makes him well prepared and well set up to be able to give good advice.
All right, Angelos, I want to thank you for your time and being our customer. And yeah, your 3D machine looks fantastic there in your room. And thank you for your time today.
Thanks, Daniel.
Cheers.